Hi, hello Ravi, and thanks once again
Hi.
for joining us. So I just wanted to ask you briefly, what are the key changes do we need from the leader's perspective, from what leaders are thinking, to take healthcare from where we are to and transform it where we should be?
I think, Vikram, that's a great question to ask. I think all of us have been struggling with this question for decades now. And as I see it today, the way that we are positioned, there are five vectors that we need to take care of. Number one is on technology. Number two is on the solutions approach that we need to take. The third one is on the commercial innovation. The fourth one is on consortia. And the fifth one is the industry academia interactions. Let me delve on it for a minute. When we look at technology, we find that digital is the way to go. Any amount of resources that we pump into the system is not going to take us to where we want in terms of our meeting our infrastructural needs. Digital has the capability to be a force multiplier in terms of pushing the healthcare from where it is available to where it is actually needed. If we look at commercial innovation, that goes hand in hand with technology. Gone are the days where you were doing a black box selling. What the hospital now wants is basically a solutions approach which blends itself into a consortia way of working, in the sense that you've got multiple partners coming in and contributing, each one contributing to their capability and also getting rewarded for it. So from that perspective, we need to have business models which sort of support this, and also the backend infrastructure to take care of this piece. The third one, as I said, is on the consortia approach. We talked about it. Academic industry interactions is another big piece that is sort of missing in the Indian context. Take, for example, Israel, or take, for example, the United States. Why is it that they have so much more successful startups and unicorn in the healthcare space, where we in India, we don't seem to have it? I think it is fundamental that the curriculum of today has to cater to the technology of tomorrow, not delve on what the past was. So from these aspects, I think from a leadership perspective, we as leaders need to drive these five vectors to the extent that we can, to ensure that we are able to usher in an era of healthcare which we really aspired for, and all of us want to be in that place in the coming years. I hope that answers your question.
Yeah, thank you, Ravi. Thank you for sharing your insights with us.